Just before we get on to the main business, let me just say a few words about why we're having this seminar, though I suppose it's going to be obvious to most. I mean, the COVID-19 pandemic had a substantial impact on social surveys. With the initial lockdown coming into effect in March, survey organisations had to move quickly to stop face-to-face interviewing. And as the pandemic has continued, a collection of survey organisations have had to adapt and evolve to enable them to continue collecting data about people and households, and to introduce new surveys to provide insights into the effect of the pandemic on society. And all this has come at a time when our understanding of society is of greater interest than perhaps ever before, as we use data from social surveys to understand the impact of the pandemic on our daily lives. So the period has brought a number of challenges, but also opportunities to those organisations that carry out social surveys. And this is the first of two seminars organised by the RSS Social Stats section, which is going to look at the impact of COVID-19 on data collection for social surveys. It focuses on the approaches of different survey organisations in responding to the challenges and making the most of any arising opportunities. So as I say, this is the first of two, and today we're going to hear from Gillian Pryor, who's the Director of Survey Research at the National NatSen, and she's going to talk about NatSen's quantitative response to the pandemic. Then Alex Bogdan, who's an Assistant Director at Ipsos Mori, is going to talk about the British. Come back NatSen again for Kerry Davis, who's the Director of the Centre for Deliberative Research there, and she's going to talk about the impact on qualitative research. So I shall now mute myself and hand over to Gillian, who will take on the first presentation.
Talking from the NatSen perspective about what we've done particularly around responding to COVID. So just to start by giving an overview of where we were at the beginning of March, as Tricia mentioned. So it's worth saying, first of all, this presentation really relates to work using random probability samples, because that's what we focus on in NatSen. But just a quick recap of where we were. So we had something like 15 large-scale face-to-face surveys that were live or about to launch. Sorry, can I just check? Have you got the slides properly now, or are you still seeing the notes in the sidebar? Sorry about this.
Yeah, it is there. We can still see part of the sidebar, but I think it's okay to kind of go on with. Well, I personally can see the slides. Yeah.
Apologies. Right. Sorry about this. Right. Okay. So as I say, we're saying that it relates to random probability samples, because obviously that's what we focused on at NatSen. And where we were in March, 15 or so large-scale surveys about to launch, including our big continuous and national statistics surveys, other studies like NCDS, BCS70, more ad hoc studies which were due to start. And several of our studies involve objective measurements like biomedical measurements, and we have housing surveys where we do surveys of accommodation and so on. So, and obviously all of this had to pause in late March. Now, there were some very immediate responses to the fieldwork pause. And obviously, to begin with, we didn't know how long this was going to take, how long this was going to last for. Some study leads did make an early decision to pause data collection for an extended period, say a 12-month delay, which we implemented on several studies. Others were keen to continue data collection using alternative modes. And at the same time, we've obviously had the demands for new data collection, as Tricia mentioned, particularly for surveys in response to the pandemic, where we really need evidence on how it's affecting people's lives and so on. So I just want to summarise quickly the changes, the kind of key features of changes that we had at NatSen. So first of all, one option was push to web. Now, this has been growing survey mode in recent years, and takes the form of a letter to a sample inviting them to complete a web survey. And there are various options for different follow-up modes, or it can be an online service. That was one mode which obviously can continue but doesn't rely on face-to-face interviewing. The second one is what we're calling push to CATI. It's not something that had really been considered or trialled before COVID, but essentially it's an opt-in model whereby the sample is written to and asked to provide their contact details so that a remote interview can be carried out, which would usually be by phone, but it could also be by video. And then thirdly, web or CATI, or web CATI. And again, this relies on having a sample to be able to contact, and it uses letter or email invitations to invite people to complete a web survey. Telephone can be used to encourage response and also complete interviews. That's really the three broad groupings that we've been implementing in NatSen since March. I'll say a bit more now about each of them individually, and give some examples of studies where we've implemented. So, first, push to web. So, we've done this on a range of studies, including the British Social Attitudes, a trial for Health Survey for England, and a new study about implementation of Test and Trace app, and so on. And as I said, this starts with a random probability sample, like an address-based PAF sample. People are sent an invitation to do a web survey, and there's various ways of implementing it with different options for reminders and follow-up modes and so on. And response rates at a household survey are typically something like 15%. It can be higher depending on the extent of follow-up activity, the topic of the survey, and so on. There's a lot of issues to consider in implementing a push-to-web method. People do whole seminars about this, so I'm just not going to go into a lot of detail, but there are some key issues around things like how to implement the sample selection within a household, the length and complexity of the questionnaires, and particularly if a postal questionnaire is going to be offered as a follow-up mode. And also for a survey that's moving from a CAPI to a push-to-web mode, there's significant wording changes needed to move to self-administration versus interview administration. So to give an example of this, of how we've implemented push to web, if we look at the British Social Attitudes 2020 survey, now many of you will be familiar with BSA. It's a very long running, repeat cross-sectional survey, usually carried out annually. And for BSA 2020, we've implemented a push to web survey with up to 2 people per household invited to take part, and aiming to achieve around 3,000 interviews across GB. We decided not to implement a postal questionnaire follow-up, but people do have the option to request a telephone interview. Now, to get this into field, I mean, first of all, we had to make the decision that we wanted to do this in 2020 and get the funders' approval and so on, to the whole process of that negotiation. And then in terms of getting the questionnaire ready, so we had limited time really to develop the questionnaire once we'd made that decision to go ahead. But we carried out a rapid review of the questionnaire, changed the questions to make them suitable for web administration, and we carried out some small-scale usability testing. The fieldwork started in October, so it's still ongoing. Usually face-to-face would start in July, so that gives an indication of the time it took us to make these changes. And obviously, very importantly for BSA, it has some over more than 30 years of trend data. So there'll be a big piece once we get the results of just looking at what the 2020 results are and making sense of them and how they fit with the long-term trends and so on. Right, move on to talk about the push to CATI mode. Now, this has actually been quite a popular way of carrying out the big continuous surveys. And as I said, it's something that we hadn't ever really thought about in advance of COVID. But we've now implemented this on many of our continuous surveys, including the English Housing Survey, Family Resources Survey, National Travel Survey, and so on. But again, it starts with a random probability PAF sample. We send a letter inviting people to provide their contact details so a telephone interview can be carried out. And there's various ways people can opt in, so telephone, email, online forms, and so on. And then carrying out a remote interview. So generally, this has been by telephone, although video would also be an option. And response rates, we've been getting between sort of 10 and 15% response rate to the opt-in method. Although it's worth saying that we did get higher response rates at the beginning of the original lockdown back in April, May, and it's been dropping more recently. But this mode was very quick to implement. We began the first surveys using Push to CATI back in April. So some more points about things to consider with the push to CATI method. One is questionnaire length. Now, usually we would say for a telephone survey, we would want to aim for a shorter interview. But in fact, we found with surveys like the National Travel Survey and Family Resources Survey that we've been operating them with the push to CATI mode with roughly the same questionnaire length as we had for a face-to-face survey. So the indications are that you can successfully implement a longer interview with this method. There are some changes needed to the questionnaire, but fairly small changes to allow for telephone rather than face-to-face administration. There's quite a big issue around how to manage show cards, because a lot of the large surveys do rely quite a lot on show cards for assisting interview completion. The options are things like reading out the answer options, potentially reframing the questions to reduce the need for show cards. Potentially you could consider posting out show cards or even hosting them on a website for respondents to access. Other elements of the interview, so if there are self-completion sections in the CAPI, you need to think about how to manage those, so whether to have a separate web survey and so on. There's also a question of who should do the interviews, so whether to be carried out by regular CATI interviewers or whether to use field interviewers. A lot of our surveys, as I mentioned, carry out objective data collection and non-questionnaire data collection, so things like diaries, physical surveys, biomedical measures, and so on. And there's obviously issues around how to implement those with the push to CATI method. Another important point, I think, as this was a new method, we're kind of learning as we go in terms of how to maximise response rates. And video interviewing is another. So again, this was completely new to NatSen. We hadn't done video interviewing at all before COVID, and we've been developing all sort of protocols and systems and so on to be able to enable us to implement video interviewing. So another innovation on the push to CATI model is something we're calling knock to nudge, and again, something that we hadn't heard of before March. But this involves using interviewers to make contact with households to collect the contact details for the remote interview. So it's able to use safe protocols for socially distanced doorstep contact rather than in-home interviewing. But this has quite a lot of advantages over the pure opt-in mode. For example, you can manage the show cards much better by leaving single-use sets with the households once they agree to take part so that they can refer to them in an interview. It's possible to do some biomedical samples if they're self-administered and if you can have a contactless method of transferring them. We've been doing external housing surveys through this. So as I said, it overcomes many of the disadvantages. And we've also been seeing in our trials that this has a potential for significantly increasing response rates. So now I'll talk a bit about an example of implementing Push to CATI on the Family Resources Survey. So some key points on the FRS. First of all, it's a very large-scale survey commissioned by DWP and carried out by NatSen, ONS and NISRA in collaboration, usually interviews 20,000 households per year and provides very important data on that feeds into economic modelling internationally and so on. So very important study. Now this one, we actually began Push to CATI in April with this study with minimal questionnaire changes. And we used so opt-ins collected by multiple methods. We actually decided to use our FRS brief field interviews to carry out the interviews rather than telephone interviews. There's a whole piece of sort of making sure field interviewers are trained in how to do this and so on to implement. The questionnaire, so there were, as I said, very few changes to the questionnaire initially, although there have been more changes over time, particularly to implement COVID-related requirements around things like employment changes and so on. The show cards, the decision on FRS was just basically to read out the show cards. And what we focused on since then is a lot of work to improve the response rate. So things like changing letters, changing reminder letter strategies, incentive experiments. And one other thing is telephone number matching. So it's possible to match telephone numbers to a proportion of PAP addresses. And that means that you can phone out to the sample as well as waiting for them to contact us. We've also done a trial of the knock to nudge method on FRS, and this is really the biggest factor in improving response rates. And we're planning to implement knock to nudge on a larger scale. And so we have been getting, as I said, something like 10 to 15% without knock to nudge, but we're going to be targeting 30% plus with. So it's really got potential, I think, that method to get pretty good response rates on a national survey. Okay, we want to talk about the web CATI method. Now, again, this is something that's been, in common use already, but has increased in time of COVID. And it's particularly been an important way of collecting fresh data, including for COVID-related studies. We've implemented Web CATI on a number of projects, including mental health of children and young people, our ELSA panel of the English Language Study of Aging panel, follow-up studies to the English Housing Survey, the National Joint Nutrition Survey, and our ongoing NatSen panel also uses the Web CATI method. Now, for this model, you do need to have an identified sample. So generally, we've implemented it as a follow-up to a previous face-to-face survey. And again, it involves writing or emailing people to ask them to do a web survey, or it could be contacting them directly to do a telephone survey. Telephone could be used to encourage response or to carry out the interview, or any combination. We generally find response rates of the follow-up survey are pretty high. So we've been getting, say, between 40% and 75%, depending on the quality of the source sample, how long since they were interviewed initially, and so on. But do remember we need to factor in the response rate to the original survey and the proportion who gave permission to be recontacted. So the cumulative response rates are much lower than that headline response rate. And one point about this mode, if you do have both web and CATI interviewing, it does have a higher risk of mode effects because we know that that combination of interviewer-administered and self-administered interviews is particularly prone to mode effects. So I'll just talk a bit more about how this was implemented on the mental health of children and young people study. Now, there's obviously a very keen interest in exploring mental health of children and young people during the pandemic, and also looking at changes since 2017 when the face-to-face mental health of children and young people study was carried out. Now, it's funded by Department of Health and Social Care, commissioned by NHS Digital, and carried out by a consortium of ONS, NatSen, and the University of Cambridge and the University of Exeter. And the basic model was to re-interview children and young people aged 5 to 22 and or the parent or guardian, depending on the age of the child, whether they are interviewed directly or via their parents, or whether both carry out an interview and so on. But using follow-up from our 2017 study. And we achieved interviews with just over 3,500 people with a 45% response rate. And I think given that it was about 3 years really since we'd first carried out the interview, we thought that was a pretty successful response rate. And it was done again by use of letters to contact people, reminder letters, and telephone was used to maximise response and to assist, but not to actually carry out interviews. One key point is it was a much simpler and shorter questionnaire compared with the 2017 study, and new questions were added to talk about experiences during the pandemic. The advantage of having a prior survey is that you can do quite sophisticated weighting because we can do non-response adjustment based on who actually did agree to take part and so on from the previous round. One important part on this study, so we ended up carrying out fieldwork in July and the report was published in October, which is a really quick turnaround, and particularly compared to the face-to-face mental health of children and young people study that was originally, it was a larger study, but it had a sort of 12-month data collection period, roughly 12-month reporting period. So I think that's one advantage of this mode, is that it can be much quicker in terms of getting high quality responses over a short time. Okay, I'm going to go on to talk about a few thoughts on sort of where next for large scale surveys. One important factor is to talk about the implications for the findings. Now, all these changes in data collection, they're inevitably going to have implications for data quality and for survey findings. And we've made the changes all in a very sort of quick way without having the opportunity to carry out experiments and parallel runs and so on. There's a lot of risks around the findings, such as what the mode effects are, the consequences of sample design decisions, risk of increased sample bias because response rates to the alternative modes tend to be lower. We also, by not going to an address, we're not collecting some of the information that we would usually collect on the doorstep, which would be used in creating weighting models. And we also expect that things like consent to data linkage and to follow-up studies are going to be lower with remote interviewing. So there are a lot of different methodological impacts. But at the same time, of course, there's massive pandemic effects. Now, there will be big changes in behaviour and attitudes just because of the way the pandemic has affected almost all aspects of daily life. So really, all of these things are going to be pretty difficult or impossible to disentangle. And as I said, it's been implemented without really doing experiments, although we have some thoughts around how to reintroduce face-to-face interviewing in an experimental way. Certainly, there's going to be a lot of things for survey methodologists to look at in trying to understand the different impacts and how they're affecting results once we get to that stage. Just to touch a little bit on reintroducing face-to-face interviewing. So during the COVID period, we've been developing COVID-safe interviewing protocols. We had been making use of doorstep contact, but not to nudge and so on before the current lockdown. And obviously, our key priority is to maintain safety for both the interviewers and respondents. So there's rightly a lot of caution around a large-scale return to face-to-face in-home interviewing. I think, and that's then our feeling, is the most likelihood is that we're going to be offering the kind of hybrid models I've been discussing probably throughout 2021, possibly beyond. There will come a point where we're able to offer in-home interviewing again. I mean, personally, I think we're going to be some way into 2021 before that's going to become a realistic option. But in the meantime, certainly the models with doorstep safe contact to support remote interviewing is going to be, I think, a successful model for the large-scale surveys. So offering those options, web, telephone, or video interviewing, as well as in-home interviewing. And I think actually this may well continue as something that carries on beyond the immediate COVID period. And then what about further beyond that? So are we going to see permanent change? There's obviously been a lot of debate in recent years already about, you know, what's the future of face-to-face interviewing and so on. Are we going to see permanent change as a result of COVID? One key issue I think is around respondents. So how will they react? Will they be willing post-COVID to let an interviewer into their homes? We won't know until we try that. But in any case, I think, as I said, we can see potential for a hybrid model with telephone and other alternatives available to have advantages even once the pandemic is over. We've also really seen the value of follow-up studies and panels in this period, and I think we could see more demand and potential for those within the random probability survey landscape. We can also imagine that some surveys, having moved away from face-to-face interviewing in the current period, will make this a permanent change, and will find that the alternatives are sufficient to meet their evidence needs. On the other hand, though, we've also seen through this period, it's really highlighted, I think, the many advantages of face-to-face surveys which the other modes can't necessarily match. For example, in response rates, in the length and complexity of the data that can be collected, the avoidance of mode effects, and also particularly collecting objective measurements. And certainly I know that many of our customers are very keen for their surveys to return to the face-to-face in-home mode as soon as it's safe to do so. So I think we certainly see a strong future for face-to-face interviewing once we get through the COVID period. Thank you.
Thank you very much. Just let me turn myself on again. Thanks very much, Gillian. That was really interesting. I mean, I think that there's going to be so much methodological work coming out of this to measure the impact that we're going to be kept in seminars for the next 2 or 3 years. I think there's plenty of. And I've got a couple of questions here that I've got 3 questions. Let me just go through them. One from Annika Dawson, who's saying, can you say a bit more about how you do the telephone matching and knock to nudge methods of chasing and the response that you get to that?
Yes, so telephone matching is, so there's an agency, you get to see if you can match the telephone number to the address. Response, I don't know that we have any figures on response for that. I think it's something that can be used to support the other modes. I don't think we've got specific figures on how that's improved response, but it's part of the ways in which, you know, we can contact respondents and try to improve that, the opt-in methods and so on.
Okay, thanks. And then could you say something about the CATI length of questionnaires? I mean, somebody's asking here, were any of, Tim Hansen is saying, were any of them long, you know, up to 45 to 60 minutes? What did you think the maximum length was?
Yeah, so with the push to CATI methods, as I said, so things like the Family Resources Survey, so the typical interview length is around sort of 45 up to 60 minutes for these continuous surveys, and we've been implementing them without really reducing the interview length, and found that successful. So yeah, I think that's a finding which is different to what you would normally say with a typical CATI survey, where you would try to keep the interview length shorter. So I think with the sort of knock to nudge support and the opt-in method, we are finding it possible to carry out longer interviews.
And a kind of follow-up similar question to that is, what about the length if you're doing a video assisted interview? Is there a difference between what you can do on video assisted and that you can do on other types?
Yeah, so with video, we haven't done much. We've done some trials of video so far, working with the Centre of Longitudinal Studies on the British cohort study. But I think that's been very successful, and we have actually found, you know, in some ways, things like show cards you can manage better with a video interview because you can show the material. And again, I think the potential to do long interviews, they seem to be able to do a sort of regular face-to-face web interview through the video method.
Okay, there's some questions here about the representativeness of the sample. I'm assuming that probably that's going to be some of the methodological work that's further down the line. Is that right, or is that something that you're doing at the moment?
Well, I think so. I can see the question being around push to web. So it's a known thing that push to web samples have differences in terms of composition compared with the face to face, and as you say, particular groups are less likely to respond online and so on. So yeah, I think it's a question of doing what you can to give people opportunity to take part through things like the telephone mode or the paper survey questionnaires and so on. But yes, obviously scope to see, how much that can be mitigated by waiting and so on, or how much there remains an effect in the data.
Okay, I can see that there are other questions, and obviously, it's an interesting presentation, and people will want to ask questions. But I think we better move on, or we'll run out of time at the end. We may be able to come back to some of these questions at the end of the presentation if we've got time. So sorry if you haven't had your question asked, but I think we better move on as it's 1 o'clock now. Thanks again, Gillian. That was very interesting. And can we move on to Alex now? Thank you.
Today, I will be giving you a bit of a background on the British election study, and also talk about the initial design that we had implemented for a face-to-face study, take you through a bit of timeline this year, and then talk in more detail about how we transitioned the study to push to web, some of the response rates that we achieved, and outcomes. So just to start with a bit of background on the British election study, this has been running since 1964 after every general election. It looks to offer a high quality data on why people voted the way they did at each election. And while there are many different strands to the study, what I would be talking about is the address-based random probability sample that up until now has always been conducted face-to-face. The British election study is managed by a consortium between the University of Manchester and University of Oxford. And this year, fieldwork was run by Ipsos Mori in partnership with our colleagues at NatCen. So this wave, just as always, started off as a face-to-face study. Our sampling units were LSOAs within 400 parliamentary constituencies across Britain, and in each of those LSOAs, we selected 11 addresses. In London, we selected 13 addresses just to counteract the fact that London tends to have lower response rates. We conducted 1 interview per household, and respondents were selected randomly via a Kish selection. And in order to take part in the survey, they had to be eligible to vote in general elections. We implemented an incentive strategy that offered a range of incentives depending on respondents' characteristics, so especially their age, with younger respondents being offered a higher incentive to try and maximize response. And interviewers were conducted face-to-face and administered by an interviewer, and usually took in between 40 and 50 minutes to complete, so quite a long interview. And just to very quickly remind you of the timeline of this year, because it has been a very long year for BES, as it has been for all of us, I'm sure. So you might remember in December last year, we had a general election. Back then, we thought our biggest concern then was that we had to start fieldwork in the dead of winter, which is always a bit more problematic and a bit more difficult, but we promptly did that. And in the background, towards the end of January, the first confirmed case of coronavirus was identified in the UK. In the meantime, we were still conducting fieldwork, we were still doing interviews on BES. But in mid-March, the UK government issued guidance against non-essential travel. And they later, on the 17th of March, all face-to-face fieldwork in the UK was halted as a result of MRS guidance. So at this point, we had achieved 2,095 interviews, which was just over half of our interview target for BES this year, which really wasn't where we wanted to be. A few days later, we had proper lockdown with quite strict restrictions on movement. And we also started transitioning the study to push to web. And towards the end of April, we launched a face-to-face study and finished fieldwork on the 10th of July. So from what was originally a very classic face-to-face design, we moved on to a push-to-web design that is slightly different to what is usually found in the literature. I should say that because everything was happening so fast, we didn't really have the opportunity to conduct any experimental designs, to do any experiments. So everything, all of the decisions that we made, everything was really geared towards maximizing response for this survey. But it does mean that throughout the day you should keep that in mind as I go through some of our findings. So as I said, the design is somewhat different from a classic push-to-web design. Usually, the big advantage of push-to-web is that you can issue a completely unclustered design. Sorry, a completely unclustered sample. Whereas that wasn't the case for us. We issued all of from the original sample that we had selected for the face-to-face survey, we issued all non-response up to that point to push-to-web. So that included hard refusals, included soft refusals, people who hadn't heard of the study before, some people where we had made some contact but just weren't able to get an interview when we had to stop. So we only excluded a small number of cases, including hard refusals, cases where we know people were ineligible to take part, and some that would. We sent out postal invites asking people to take part in the online survey, and this was followed up by 3 postal reminders. And with the third mailing, which is a second reminder, we also made available a paper questionnaire for people who are offline or just less likely to go online to complete the survey. And our incentive strategy included unconditional and conditional incentives, which I will come back to later. So I will now just go through some of the key decisions that we had to make in redesigning the survey, and that's starting with the survey instruments, the questionnaire. And a lot of work went into redesigning the questionnaire for self-completion. So this included some minor wording changes just to account for the fact that there isn't an interviewer present to ask the question, tell us instead of please tell me. We also had to decide what to do with non-response options, don't knows and prefer not to says. In the end, we decide, so normally on a face-to-face study, these would be unprompted, they would be available to respondents, but not necessarily shown. We decided to show all of don't know and prefer not to say options in the push-to-web survey, and also made some available at questions where they didn't exist before. And this was really done to try and improve the respondent experience as much as possible. We also had to consider the impact of the new fieldwork dates on some of the survey estimates. So for example, in BES, we ask about the most important issue facing the country, the economic situation of the country, of the NHS, and these are really key in trying to understand why people voted the way they did. But obviously, all of these would have been massively impacted by the pandemic. And really, at this stage, they wouldn't have helped very much in explaining why people voted the way they did back in December. So all of these had to go. In the end, we ended up with a questionnaire that was quite long. It took 38 minutes to complete online on average, but we had surprisingly very few breakoffs. So I think, it was quite interesting that we didn't see as many people sort of drop off survey as we expected. And then turning to sampling, as I said, usually quite a key benefit of push-to-web is being able to have an unclustered sample, but that wasn't the case here. Out of the almost 9,000 addresses that we had initially selected for the study, we issued almost 6,000 addresses for the push-to-web survey. And this included a mix of samples, including fresh samples, so people that we hadn't approached during the face-to-face stage at all, just because we hadn't got around to it. Also cases where fieldwork was interrupted, so we had made some contact but just didn't get an interview. Some soft refusals, people that maybe wanted to take part, but it wasn't convenient at the time when they were approached by interviewers. Some deadwood where we weren't able to locate addresses, and a lot of non-contacts. And a very difficult decision was how to select the person in the household who would take part in the research. So without going into too many details, from the literature, we have a few options. We could either ask people to conduct some sort of quasi-random selection within the address, for example, the next birthday, or we could have allowed more people per household to complete the survey, say a maximum of any two adults in the household. Now, we do know from the literature that many people don't follow the selection rules like the next birthday. But on the other hand, we are also very conscious that a lot of measures that are key on BES have a very high within household correlation, a lot of the political attitudes and voting behavior measures. And we were also keen to try and maintain as much consistency as possible with the face-to-face element. Therefore, in a sort of slight departure from standard, we decided that in cases where we knew the name of the pre-selected respondent from the face-to-face stage, we would approach that individual to conduct the survey. But in the vast majority of cases, where we didn't have a selected respondent, we asked one person per household to complete the survey, and we asked them to select the person by using the next birthday approach. We also tailored communications to people's previous experience with the survey. So this could have been, as I said, fresh sample, people who weren't aware of the survey at all. So we had to just introduce the survey. But also we had cases where that ended in a refusal, or potentially we weren't able to conduct an interview for other reasons. And in some cases, we were able to identify a selected respondent and had their name. So for those individuals, we addressed the letter directly to that selected respondent. So overall, our take-up of the Push2Web survey was 31%. And if you look at those bottom two rows where we had a named respondent address and we were able to address the letter to someone, response is really much higher than the average. And this is to be expected. People are just more likely to open mail if it's addressed to someone in the household, instead of just chucking it in the bin. But then if you look at the first three rows, that shows response rate amongst households that were just letters that were addressed to the householders, we really don't see that much of a difference in response between people who hadn't been aware of the survey at all and people who had some sort of contact with interviewers. And this really went somewhat against my own hypothesis. I would have expected maybe a higher response amongst those who have been primed before and knew about the survey, and potentially a lower response amongst those who had refused before. But actually what we see is very similar response, just about 30% amongst all of these three samples. And then finally, one of the other thing we had to consider was the incentive strategy. So during our face-to-face stage, our incentive strategy was really tailored to the participant. We had different incentive levels depending on where people lived and based on their age. So in particular, 18 to 24s were offered a bigger incentive because we know those individuals are just less likely to take part in surveys, and interviewers found it helpful to be able to offer a higher incentive to try and convince them to take part. Obviously, this is only possible because interviewers are present and they're able to establish who lives at the address and then be able to offer that higher incentive if the selected respondent is aged 18 to 24. But this wouldn't be possible on a push-to-web design without also massively incentivizing fraud. Instead, what we decided was to offer a mix of unconditional and conditional incentives. The reason for that is because we know, again, from the literature that unconditional incentives are really the most effective in driving response. And we also increased the conditional incentive with that final mailing. So what did all of this actually get us? So overall, we were very happy with the response. We achieved an unadjusted response rate of just shy of 44%, and that's across all three modes, so the entire life of the study. This is actually higher than what we achieved in 2017, where we implemented a classic face-to-face design, but where we had a genuine snap election that no one really was expecting, and therefore we had a very, very short time to prepare the survey. It's not as high as what we achieved in 2015. I should note that because due to the mixed mode approach, calculating an adjusted response rate becomes a lot more difficult. So adjusted response rates usually take into account the level of ineligibility in the sample and also of deadwood of addresses that aren't residential. And this is usually established by the interviewer visiting those addresses and talking to people in those households. Obviously, while we did that during the face-to-face stage, we couldn't do that during push-to-web. For push-to-web, almost all non-responses look the same. There are very, very few cases where we can say with certainty that they are not eligible. So really, getting to an adjusted response rate that would allow us to compare like for like with previous years is a lot more difficult. And just to look into a bit more detail at the online response, where we can identify by day how many people completed the survey. An interesting thing we saw is that 65% of all online responses were received before the first reminder landed on people's doorsteps. And this is really a bit higher than what we would expect from previous surveys that we've done in the past. And a few explanations for this could be that the sample was primed. People, many people in the selected sample knew about the survey from the previous stage and maybe knew what to expect. So if they were going to do the survey, they did it immediately. Equally, could have been the unconditional incentive. I'm sure having a £5 vouchers without any, before having to do a survey potentially helped. And also it might have been the lockdown restrictions. So at this time, even though I don't think we were in proper lockdown, there were still quite a few restrictions, a lot of people working from home. And it might be that people had more time on their hands. So again, if they were going to do the survey, they did it immediately. And then the last thing I like to talk about is some of the survey outcomes, starting with the sample profile. So I won't be showing all of the detailed numbers, and you'll be able to find out when the data set is published. But in many ways, just to point out that samples skewed as we might have expected. In the online sample, we found respondents to be younger, more likely to have a degree, to be owners on a mortgage, to report not having a religion, more likely to be working full time. Whereas in the postal sample, we found the reverse. We have found older people, retirees, people with education below the degree level, homeowners, people who identified as Christian and as white British. In both the self-complete samples and especially in the postal one, we found a skew towards women. And I think this really acts as a reminder of how important interviewers are in enforcing that random respondent selection and also convincing that selected respondent, if they are reluctant, convincing them to take part in the survey and therefore ensuring a more balanced sample. And overall, the face-to-face sample was fairly balanced. And then just turning to survey estimates, the key measures in the survey are how people voted at the last general election. Just a note before I go on that the data shown here has been weighted with selection weights. It hasn't yet been weighted with any demographic weights. So do keep that in mind. So what we see looking at turnout is that the level of reported turnout is fairly similar across the three modes, just around 80%, slightly lower online. But it is potentially, we could have expected even lower reported turnout online, given that there is quite a big skew towards younger people who are less likely to vote. And then looking at vote choice, so the results are overall across the entire study are very, very similar to the actual results across Great Britain, with party vote shares being very similar. And I'm sure once we apply the demographic weights, the slight imbalance will be further corrected. And just looking at the face-to-face samples separately, this as well is very, very close to the actual election results. But there are some interesting differences between the online sample and the postal sample. So just looking at these numbers, what we see is that conservatives tend to be underrepresented in the online sample, which you would expect due to the younger age profile. And they are overrepresented in the postal sample. And then similarly, in the postal sample, what we find is that Labour and Lib Dems are underrepresented. But really, once we combine all of this data to one, the overall vote shares are very similar to the actual results. Just to come back to some of the key learnings from this experience, I'd say one of the important things is to really give careful consideration to the questionnaire, not only in length, which would really drive the respondent experience with the survey, but also looking at how to present non-response options, how to phrase questions so that they're suitable for push to web or for a self-completion. We also found interestingly that the sample that was approached by interviewers during the face-to-face stage wasn't necessarily more engaged than the fresh sample, with the exception of the few people that we had identified before by their name, which I'm taking as an indication that they were already very keen to take part, but it was probably not possible because we had to stop field work or because it wasn't convenient for them when they were approached by interviewers. I should note, though, that the interaction between interviewers and respondents really wasn't designed to increase push-to-web response. So I don't want to suggest that interviewers don't do anything in engaging participants. I think they can do, but we hadn't, not knowing that we were going to have to redesign the study, we didn't really design that interaction to help increase push-to-web response. In terms of the samples that we achieved, the skews in the online and postal samples really are as we would have expected and mostly driven by age. But final sample profiles and estimates, once you combine all of that data, really look encouraging. But of course, a lot more work needs to be done this and looking at different survey estimates as well. But overall, I would conclude that postal is, including a postal option, is really essential for a balanced sample to try and correct some of those imbalances driven by the online sample in the online element. And just overall, I think it is a very good time for push to web. We see that fieldwork times are much shorter than on face-to-face. We have had very good response, at least on the British election study. There are some challenges, of course, but overall, I think it is a very good time for it. Thank you.
Thank you very much, Alex. That was very interesting. Okay, we've had some questions. I'll just start with the first one, which was about the decision to go to push to web. Did you consider telephone interviewing before you did that? Were there any considerations about that?
Oof, I need to think back to a long time ago. I think we probably did consider telephone, but I think. I don't think we spent that much time thinking about it because of the mode effects in particular, they do tend to be on the face-to-face element we use show cards. And really, that's, even though there are some challenges in moving that to online, non-response options are obvious, but it's a lot simpler, and the transition is just a lot more obvious from face-to-face with show cards to self-completion.
Okay, thank you. And then a question about item non-response. I mean, you said a bit about response, but item non-response, was there a difference there between the two approaches?
Yes, so I didn't go into that at all, actually, but we did see a bit higher non-response in both self-completion modes. Not anything outrageous, but at some questions we did. We haven't yet looked at all of the questions. Some of them, yes, a bit higher. Interestingly enough, we saw lower non-response when we asked about income in the postal question, in the postal data, and we think that's because we grouped the income bands to cover a wider ranges. So I think just that it is worth considering with some questions, maybe losing some level of detail to try and get more responses.
Thanks. And then there's just a couple of questions. I don't know if you can see them other than me read them out, Alex, but there's a couple of questions, people interested in the conditional incentives. One was saying, was the final mailing offering a £50 a conditional one? And what were the conditions of the conditional incentive?
Yes, so so when we, in the first mailing, we sent out a voucher worth a high street voucher worth £5, and that was unconditional. That was sent out with every mailing. But then we also promised another £25 voucher if people would complete the survey, initially if they did it online, and then also if they returned the postal questionnaire. We also promised a £25 incentive, which we would then deliver after we received the surveys. And yes, we increased the conditional incentive to £50 with that final mailing, just to try and get the most reluctant people to take part if they would. And we did see a slight uptick in response after that final mailing. So I do think it did help. It helped convince some people. It was a slightly higher uptick than we would have seen from a final fourth mailing in the past.
Thanks very much again. Thank you.
Thank you.
So we'll move on to our third and final presentation, which is by Kerry Davis from NatSen again, but this is looking at a different aspect, looking at qualitative interviewing. So Kerry, can I hand over to you?
So I really just wanted to spend 15 minutes or so kind of offering a perspective from the kind of qualitative side. So I appreciate that this has largely been survey focused seminar, but we felt this was a good opportunity to also just share some considerations and thoughts about what effectively social distancing and the impact of the pandemic might also be on the kind of other side of social research. So I thought it'd be worth just starting off by, excuse me, by pressing the right button. So hopefully it will move. There we go. I thought it would be worth sort of saying that certainly at NatSen, my work is pretty much characterised by deliberative forms of research, and I tend to work on projects related to democratic participation and innovation. But obviously, there are many more different aspects of qualitative research that we do at NatSen. So this is a sort of more generalised presentation, although some of the examples are more specific to the types of work that I do. I've also decided to do something kind of more general in terms of context, challenges and opportunities, rather than talk through in detail a specific project. But again, throwing in some examples there just to illustrate some of the things that I wanted to mention. So I thought it was always worth trying to locate where I think we found ourselves largely in terms of qualitative social research. And again, many of these points have been made sort of previously, but I think it's worth just sort of setting out the terrain in terms of what I'm going to talk about. So obviously, implications on social distancing impact our social research, I think, in three main ways. One is on field work, which is the kind of obvious bit. And both in new projects, but also in terms of converting current studies. And Alex's example there is a prime candidate for kind of having to switch halfway through. I also think that it means we have to give consideration to how we work with participants and with our partners, where we're collaborating on bits of research. And also, one of the questions that's come up for me quite a lot in my work is how can research designed in a kind of pre-COVID time that hasn't yet delivered its findings, but will deliver them sort of now. How can we place those findings in what are very different, often very different kind of policy, political and social contexts than when the research was kind of first designed or realised? So there's an inherent challenge there about how to make sure that those findings are both useful and can be implementable when so many other parts of the picture have moved during the time in which the study was taking place. And then there are two kind of supplementary questions which I've kicked about in terms of the context of COVID-19 is obviously what role can or does social research play during the pandemic? And also how can we think about framing and designing research that can ask and answer questions about the future when the future itself, again, kind of in terms of social contexts, is so uncertain and so unknown. I should say that obviously with the potential for a vaccine to be delivered in the next couple of months, that will start to perhaps mad speculation, but start to kind of bed down some things which were previously very uncertain. But I think, the work that we do to inquire about social conditions, policy research and the world more broadly is obviously now framed within even greater uncertainty. And I think that provides particular, both intellectual but also very practical questions about how our research can be designed and used. So that's the kind of bit of a backdrop to some of the things that I was going to cover. And I think the first thing that thinking about impacts of pandemic on data collection and on qualitative social research in general is characterised within these bunch of things. So I think that as researchers, we're challenged to ask some questions about whether we reorient our research in the way that Alex has described with the British Selection Study, whether we have to pause our research because we can't find practical or ethical ways to continue it, whether we adapt what we're doing, whether we just try and switch modes or pick alternative designs, or whether we have to stop altogether because the feasibility of what we want to do is suddenly kind of brought sharply into question. And certainly kind of March, April, May time, there was a really live set of discussions amongst colleagues at NatCen about which of these things might apply to projects that were already ongoing. And you can see here, I've just picked out some examples of what I think are some of the underpinning decisions about whether any of those things on the top happen for forms of qualitative research. There's something for me, for example, obviously around recruitment and how you find respondents and some of the traditional modes that a lot of qualitative research relies on if we're thinking about focus group research, for example, or finding people for interviews. In the social research world, it's very common to use recruitment agencies, and they often rely on a kind of face-to-face or street recruitment. So that might have been traditional, and obviously there are reasons that can't happen at the moment. I think there are also very obvious questions about study design, which I'll say a little bit more about in a minute. Questions about mode. So what do you do? Do you just take things online, which in a lot of our work is what we have done, going back through telephone modes or, kind of pen and paper type approaches, which are generally less common in qual research just because of the nature of the questions and the inquiry. There's also a question, I think, about kind of burden and in terms of both kind of care and ethics, but also in terms of not just change realities for us in social research, but also change reality of civil society partners who we commonly work with, as well as our colleagues in government. And what it might mean at this time to have to engage in the extra investment that's required in trying to think through some ways to keep your research show on the road. And I also think that in terms of making selection decisions about what to do with our research, there's also a question about how much data might already have been collected and whether that's sufficient or whether you need to keep moving through options to try and develop the research further. I think there's also something which I'm seeing quite a lot coming across our kind of ethics committee desk as well about the types of questions that we might be asking people in this time. So even though we might be involved in forms of social research, we now might be adding in some kind of COVID related questions, as we've done in a few examples of research that I've been involved in. And so the minute you start to introduce questions or queries, or indeed, kind of rapid turnaround research, which is interested in people's experiences and kind of next steps for kind of COVID times and beyond, you start to have to consider what questions you're asking of people, and how that might land in terms of kind of ethical and moral responsibilities, because people have had such different experiences of the pandemic, and some of those have been particularly challenging, and inequalities have persisted in that time. So there's a whole bunch of considerations, I think, that go into the pot around the impact of the pandemic on fieldwork, but also, on the kind of broader frame of qualitative research. So these are just some of the things that I think certainly came to my mind when I was thinking about the question of what this means, and what we might do about it. So I just wanted to kind of give one example before I talk more specifically about some of the challenges that arise, of work that we've been doing that's ESRC funded, on a project called The Future of Britain, which it started in January last year. And so we designed this project pre-COVID, and using an approach called deliberative polling. Actually, in June last year, we weren't trying to do a face-to-face poll. We were actually trying to experiment with video conferencing software as a way to kind of bring people together in this deliberative format. So even it was quite timely in the end, but kind of pre-COVID, we'd started exploring alternatives to kind of data collection and fieldwork in these modes. And as you can see, that involved bringing together members of the public from across Britain, along with research staff and panels of experts, using Zoom, and alternating between a mixture of small group, and plenary discussions over one weekend. And the plan with this project was to kind of see if we could develop a sort of proof of concept around using online formats with deliberative polling, and then to repeat the exercise, but face-to-face, in June this year. So that was the original plan. And obviously, in the meantime, the pandemic appeared, and as did what disappeared was our plans for the opportunity to go face-to-face. So what we decided to do was just go back online. And in some senses, as I say, kind of built a sort of proof of concept and some capabilities around being able to use the deliberative polling method online. And so the learning that we've drawn from 2019, we put into October this year, and effectively repeated the event. So this is an example of where we essentially kind of adapted and decided that it was important to keep the research going, that we could find a way to do that, that we didn't think it was going to have any kind of detrimental impacts on the study itself. And we also understood something of the challenges, some of the opportunities and some of the practicalities of inviting people to come and participate in an extensive piece of qual research online rather than in a face-to-face example. So this example is also quite a useful illustration of some of the challenges I think that qualitative researchers have. And I've got qualitative here in brackets because these are by no means, I'm sure, restricted to people doing qual research, and they no doubt apply in many different ways in the kind of survey space. But I think that the experience of the Future of Britain project and the challenges which we have faced with some more of our qual work at NatCen over the last 6 months or so essentially relate to some of these kind of questions. So if there's a general assumption, which I think there has been in a lot of social research, that one of the responses to having to move away from face-to-face is to switch online and try to find kind of creative and new ways to both access research participants, but also kind of provide useful study designs in order to still be able to answer our questions. I think, these are some of the considerations, really. There's something really obvious in that assumption about a switch to online, about sort of safety and security. So the minute we're on to kind of using technologies, using platforms, different types of software, we have to think principally about the safety and security of our participants, not just in a digital sense, but also in a kind of physical sense, whilst they're participating virtually. So I think it's not just about software, it's also about the setting that people can participate in. So we're assuming that they have somewhere to be, we're assuming that they've got somewhere quiet. We have to think about the amount of information they might be sharing online, intentionally or otherwise, in terms of usernames or email addresses. Kind of people's home backgrounds is essentially what you're being invited into when people join something online. And so I think there are a series of considerations there around or challenges to be worked through, which are more or less appropriate depending on different types of research design, depending on your participants and depending on the subject of your research. And so I think, there are obvious limitations with a kind of video conferencing thing like we're doing now, which may call for different modes to be more appropriate, or alternatives to be addressed. Obviously, then in terms of study design, often adaptation is needed. But if your work is longitudinal, or it's kind of, I don't know, locally situated, you're doing ethnography, something highly participatory, studying something that itself is not currently functioning very well in terms of the phenomena that you're exploring, then you need to think about tools to support delivery. And the ways in which your design might otherwise have to be kind of broken up, where optionality can be increased for people. And so, yeah, how those different things kind of impact, I think that's another kind of core challenge. Again, there seems something very obvious, but nonetheless, it's a live issue that I'm not sure is kind of adequately resolved, although lots of people are thinking about it, about questions of access and inclusion in terms of taking things into an online space, or indeed using more kind of online means or relying on databases in terms of finding participants. So yeah, something about how you're going to put in place checks, tests, provide equipment, provide mobile data, other barriers that arise in terms of the possibility for people to be able to participate in the research design in more online spaces. And the only other thing I'll pick up on this slide is about this idea about whether you're doing synchronous fieldwork or asynchronous fieldwork. So much of my work assumes people are participating in real time. So we're coming together in a workshop setting or over a weekend in order to move through a series of small group discussions or focus group type work. But it's also the case that one of the impacts and one of the challenges is about whether it's entirely appropriate, for example, to pull people together for a whole day to have to be online synchronously, or indeed whether you need to break up your study design into sections which allow people to participate offline as well as online, and whether there's a way in which to combine those things in terms of the exploration of your data. So that's another kind of core question which I feel is around quite strongly in this domain, and as I say, presented very much as a challenge, because I think people are still very much grappling with what those combinations look like, and what is most useful and engaging for participants. So in terms of grappling with the challenges, I thought I'd also just drop in another brief example around some work that we have been doing for DEFRA. So this is a 2-year-long project. So obviously started kind of pre-pandemic, started at the end of 2018, which was looking at citizens' engagement with the environment. So what citizens value and prioritise about the environment, and what their appetite might be, or explorations between the intersection between citizens' values and perspectives and forms of environmental policy making. And we had 2 different types of fieldwork planned for this project, using 2 different methodological approaches. And rather go into them in lots of detail, this slide is really just intended to give an example of how we grappled with some of those challenges I've just shown you in terms of converting something which is all predicated on face-to-face. All our understanding and all our good practice is kind of predicated on people being face-to-face, and having to think about ways to continue the project, which is the choice we took, and try to complete the fieldwork, but by moving it online. So you can see from the first set of boxes, which are more purple than pink, if you can see that. Our original plan, this is just showing you a snapshot of part of the broader work that went on, but was to have a whole day kind of dialogue with participants that had been drawn from previous participation in the project. So we didn't have any issues with recruitment, but our plan was to put them all back in the same place to have a sort of summing up type conference conversation, and clearly we couldn't do that. And these were people coming from all over England as well, so clearly we couldn't do that. And so instead, what we decided to do was actually obviously move online, but break up our approach into 2 stages. So rather than try to replicate a 1-day face-to-face event, which we thought wouldn't be, we thought there would be inherent challenges in that in terms of sustaining participant engagement and making the discussions meaningful. And also when you're removing that slight element of post-it notes, essentially, what do you replace them with? So instead we decided to break up and run 2 sessions, we added on a session, so that participants had the opportunity to come together to do a bit of a refresh, hear findings from their own workshops, so that they weren't just listening for a very long time, online as part of a larger event, and also get familiar with the technology and the opportunity to kind of meet each other again, albeit virtually, before we ran a week later a kind of day-long dialogue, but it was shorter than it might otherwise be in a face-to-face day where we brought people back together. And you can see from the second set of boxes that the other part of the field work that we were doing was predicated on using public events, in which volunteers who've had public engagement training deliver kind of exercises for the general public who are walking past to come and participate in. Again, unable to replicate that towards the end of the project. And so we had to look to kind of other, again, online means, but think more creatively about how we would reach people and the ways, and we tried to increase the optionality, basically, of the ways in which people could participate in a couple of different formats, which relied on kind of more passive methods, which were just about kind of submitting a virtual postcard, through to more kind of engaged and committed kind of workshop settings, basically, where people had to sort of sign up and come and participate in a facilitated session. So again, these are some of the ways that we decided within the kind of means, resources and timelines that we had left to engage with some of the challenges. No doubt some aspects of which were kind of imperfect, but, and again, I think there is a constant theme, isn't there, around for us in social research at the moment about learning by doing. So both of those things ended up, in terms of our revised plans, being executed well with high levels of participation. And again, there's definitely some learning in there for us now to take forward about how these more kind of online engagement spaces might work, through more kind of extended sessions, through things that are shorter, and through things which have got more of a kind of focus group type aspect rather than being inherently deliberative. So this is my last slide. So after kind of offering a handful of very short examples and having identified some of the challenges very briefly, I thought I'd just end on also what I think the opportunities are. And again, some of these might seem a bit obvious, but I feel like, you know, they're there to be stated, and these are some of the areas I know that me and colleagues are working in or thinking about. So certainly in terms of qualitative research, I think that there are some opportunities here in terms of the development of new methods. And I say new in inverted commas because there's always a question about other places, other disciplines, where forms, you know, different modes of research, different types of delivery have been crafted and developed over an extensive period of time. So, for example, people who do distance learning or distance teaching, I'm sure that they've got some tips and tricks in terms of sort of online engagement. But I think that we have the opportunity as social researchers to think about new methods, or how we kind of push the edges a little bit of some of the standard forms that we would normally deliver our research in. I think there are opportunities around reach, and I mean that in terms of, especially for work that requires a kind of face-to-face commitment, which might be over and above a telephone interview. I think there's the opportunity to include people who are often underrepresented in face-to-face spaces, the kind of usual suspects of qualitative research, people who might not be able to attend because of caring commitments, or related to financial restrictions, or related to health conditions. So I think that the ability to speak to people in their own homes or in their own kind of spaces is maybe more available to us now. I think there's something about collaboration and coverage, because when you're doing things virtually, you're no longer restricted, apart from by time zone, in terms of how you're bringing people together. So we've been able to shift some of our work, for example, that DEFRA project, rather than having to draw people together from different parts of the country into one place. We were able to do that virtually with the associated kind of cost savings and logistical savings that brings. And I think that very quickly on the final three things, there's something about relevance. So I think we have the opportunity to continue to make forms of qualitative research relevant to policymakers in terms of its ability to be able to provide insight into people's lives, both now, but also on a series of wider issues. And finding new methods and adapting our work helps to keep us in that conversation and include the voices that are needed in terms of the wider public, as well as other stakeholders, in terms of next steps for kind of, I don't know, I'm not going to say post-pandemic, whatever just before post is pandemic life. But finally, and a little bit more conceptually, but I do think that it gives us the opportunity to review the status quo. So lots of the assumptions that underpin the ways in which we research, who we research with, and, you know, some of the kind of traditions that we draw on I think, the pandemic has thrown up a bunch of interesting and interrelated issues around kind of structural, ethical, socio-political questions. And so I think the ways in which we conceive of research, who we include in that research and what we do with that research, it's a good opportunity to take a pause and challenge some of those underlying assumptions. So I will leave it there. Thank you.
Thank you very much. Thanks. Do we have any questions? There was one I wanted to ask, but I just wanted to see if anybody else was going to ask one. Yes, well, I wanted to ask, and it may be just not just to you, Kerry, because you touched on this on your last slide, but perhaps Alex or Gillian will want to come in on this. I think that you've all three of you shown that there are opportunities that can be taken from the pandemic, and I just wondered what your view was about the future. I mean, if let's look on the most optimistic side and say we were to get a fully working vaccine and COVID would be just put as a thing of the past, do you think that people will hold on to some of the good things that have come out of it in terms of survey research I'm talking about now, some of the opportunities, or do you think everyone will just breathe a big sigh of relief and just go back to what we were doing in the past?
I mean, from my point of view, with a kind of qual hat on, I kind of hope not. So I think that the kind of disruption, uncomfortable as it is and easy as it is to say in terms of qualitative social research, I think it has really invited in a kind of a bit of freshness around how we do things, and, as I say, kind of challenged some of the issues that we otherwise face when you're relying on face-to-face stuff about who gets involved in your research. So I would like to think that we can hang on to a bit of that innovation personally, rather than a kind of a slide back in to just carrying on head down, do it how we did before, because I think there's always room to kind of keep questioning and developing in that space. So that's what I'd say.
And I think from the survey point of view, I agree. I think there's been a lot of innovation that's been we've been forced to do because we've had no alternatives. And I think we would really want to capture a lot of the advantages of this and make sure that we retain that going forwards. So I've mentioned things like, some of the speed of turnaround we've been achieving. Also, there's things about improving, just offering people more options for taking part in surveys. I think those kind of things will persist because they're going to be beneficial generally. And then, of course, all the opportunities for methodological analysis. It's a fantastic kind of living experiment, isn't it? So there's going to be a lot we're going to learn from that, I think, going forward.
Yeah, and I think just to add to that, in quantitative research, we had seen these trends before. We this was already happening. Push to web was already a thing. That's why we were able to do everything so quickly, because there was so much work done previously. I think what the pandemic did is just accelerate some of those pre-existing trends. But equally, I think there is a hopefully when that time comes, I think we'll be able to maybe more properly reassess surveys and decide whether face-to-face or another method would be more appropriate, because no method is perfect. So I think it just gives us a lot more tools now for the future.
Thank you. I've got one question here from Annika Dawson about a difference in response rates with the new methods. Annika, do you want to unmute yourself? Because I'm not sure, was that directed on the qualitative side? Do you want to just say what was behind?
That was the qualitative presentation. Yes, please.
So I think that I'm thinking, because I've no doubt that it varies. In my experience with the work that we have been doing, I think that some of the new methods in terms of online has actually, I think it might have, my feeling is that it increases response rates, but I think what we see is a greater level of attrition. So generally, what we've experienced so far is that the number of people who say they'll come to something, so in a sort of face-to-face scenario, you can normally expect an attrition rate of about 20-odd%. So the number of people you recruit versus who turns up, so you would normally over-recruit by that much. What we've experienced so far in our large-scale qualitative work, and it is a bit different with the with smaller scale, is that attrition rate is closer to 40%. So even though it has been easier, in inverted commas, in terms of the response rate, I think to generate interest and have people kind of opt in to want to participate, we are seeing that actually it's quite a significant difference in terms of having implications for that kind of planning and recruitment part in terms of over recruitment.
Okay, thanks very much. Well, I don't think there's any more questions. So can I just say a couple of things? Just to thank the speakers, for their very interesting talks, but also for keeping amazingly well to time. So thank you for that. Thank you for all of you, those attending, and thanks to Lutz and her colleagues for organising it and making it go smoothly. Just to give a little plug, I hope you all know that this was the first of 2 sessions. So same time next week, there'll be another session, and that will cover 3 more areas. It will cover the quantitative surveys carried out by ONS. It'll look at the UK household longitudinal panel from the University of Essex, and Kantar will be giving a presentation on the crime survey for England and Wales. So anyhow, thanks again. Thanks for joining, and I hope to see you next week.